Hello everyone, welcome to my YouTube channel. Today we are going to discuss about the controlled drugs. Okay, so we will discuss 10 questions about the controlled drugs which will come for NMC Uk Cbt exam. So we'll see one by one. Question number 1, on checking the stock balance in the controlled drug record book, as a newly qualified nurse, you and a nursing colleague notice a discrepancy. What would you do? Here you can see that you are a newly qualified nurse. Along with your colleague, you are checking your stock balance, controlled drug stock balance, and you found a discrepancy. So being a nurse, what will you do? That is a question. We'll see the options. Option A is saying that check the cupboard, record book, and order book. If the missing drugs are not found, contact the pharmacy to resolve this issue. You will also complete an incident form. In the first option, it is saying that you need to contact the pharmacy and also you need to complete an incident form. So in the option B, document the discrepancy on an incident form and contact the senior pharmacist on duty. So here they are saying that you have to make an incident form and also to whom you need to contact the senior pharmacist on duty. In option C, check the cupboard, record book, and order book. If the missing drugs are not found, then police needs to be informed. You need to inform to the police. In the option D, check the cupboard, record book, and order book, and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. So in the first option, it is clear saying that contact the pharmacy. In the second option, it is saying that contact the senior pharmacist on duty. In the option C, it is the police, and option D is the nurse in charge. So definitely, to whom we will inform? You are a newly qualified nurse, and you have to inform to your seniors first. So option D is the right answer. Check the cupboard, record book, and order book, and inform the registered nurse or a person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. Definitely, you have to complete an incident form. So, option D is the right answer. Question number 2, in a patient's home where a registrant is administering a controlled drug that has already been prescribed and dispensed, the secondary signature is determined by which of the following choose the correct answer. So, what is the scenario? You are in a patient's home. Okay, in a patient's home where a registrant, so a controlled drug which has been already prescribed and dispensed. So, you are going to administer the medication, the registrant. So, why we require a secondary signature? That is a question. So, options will see. Option A, the availability of the client to witness the registered nurse's signature. The availability of the client. Okay, definitely we can eliminate that option. Option B, the availability of a registered nurse and another healthcare professional. And also option C is saying that the availability of two registered nurses. Okay, so not because of the availability of the registers, we are taking the two signatures. So we can eliminate that two options also. So we'll see option D, the local risk assessment policy. Okay, risk assessment policy is the right answer because we do not want any risk while administering the medication. That's why we are taking two signatures. Okay, here clearly they are asking the secondary signature is determined by which of the following. Is because of the local risk assessment policy. We do not want any risk while administering the medication and we do not want to make it wrong. That's why we are taking secondary signature. That's why the answer is the question, option D, the local risk assessment policy. Question number 3, how should we transport controlled drugs? Select which does not apply. Okay, make a note that the question is asked, select which does not apply. Okay, so we'll see one by one options. Option A, controlled drugs should be transferred in a secure, locked or sealed tamper evident container. Definitely those who are attended the classes, they might be knowing that one. While transporting, controlled drugs should be transferred in a secure, locked, or sealed tamper evident container. So that is a right answer because here what we want, which does not apply. So because of that, we are eliminating option A. So option B says that a person collecting controlled drugs should be aware of safe storage and security and the importance of handing them over to an authorized person to obtain a signature. So, okay, those who are collecting the drug from the pharmacy, okay, so definitely you might be knowing that the pharmacist will come along with the receipt and the medicine to the department. So while collecting, that nurse should be aware about the safe storage and the security, and also the importance of handing them to the authorized person. So that is also right answer. We have to follow that rule as well. So we can eliminate this answer, because why? Because we the question is asked which does not apply, so we are eliminating option B as well. Option C is saying that have a valid ID badge. That is also correct answer, because once a pharmacist comes along with the medicine, you have to show your ID to the pharmacist and you need to collect the medicine. So we are eliminating option C as well, because we want the answer which does not apply. So A, B, C we are eliminating. So D will be the answer. What is the D? The none of the above. The answer is the none of the above, because we are selecting which does not apply. How should we transport a controlled drugs? Select which does not apply. That's why we are selecting the answer option D. Moving to question number 4, a patient in your care is on regular oral morphine sulfate. As a qualified nurse, what legal checks do you need to carry out every time you administer it, which are addition to those you would check for every other drug you administer? So here the patient is taking regular oral morphine sulfate. So what is the question is asked? What legal checks do you need to carry out? You need to search for the legal checks option. So option A, check to see if the patient has become tolerant to the medication, so it is no longer effective as analgesia. It clearly states that that is not a legal check, so we can eliminate that option. That is telling that patient's tolerance, regarding the patient tolerance, we can eliminate that option. Option B is saying that check to see whether the patient has become addicted. Again, they are saying about addiction. So that is also we can remove, because why? We need a legal check. So option C is they saying that check the stock of oral morphine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book. Together, check the correct prescription and the identity of the patient. Okay, here which clearly states that about checking the drug, the number of drugs, and regarding the administration, everything it is which clearly states that. So check the stock of the oral morphine in the CD cupboard with another registered nurse and record this in the controlled drug book. Together, check the correct prescription and identity of the patient. So first we need to check the stock. Okay, stock of the oral morphine along with the whom? With the another registered nurse, because always remember that in the controlled drugs we need for everything we need two registered nurse, and you have to record this in the controlled book. So how much you got, that you have to check, and how much you got, that you have to record it in the controlled book, and there also you are doing it together. Then what you need to do, check the correct prescription. So you both patient, sorry, you both registered nurses will check for the correct prescription, then correct identity of the patient. Okay, so option C we can say okay, this is a right answer, but still we need to see the option D and we will come back. So option D is saying that check the stock of oral morphine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book, then ask the patient to prove their identity to you. This guy is saying that ask the patient to prove their identity to you. In that word itself, we can, what we can do, we can just eliminate that option D. So right answer is the option C. Check the stock of oral medicine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book. Together, check the correct prescription and the identity of the patient. Moving to question number 5, who has the overall responsibility for the safe and appropriate management of controlled drugs within the clinical area? Who has the overall responsibility? They asked. So we'll see the options. Option A, the nurse in charge. Option B, all the registered nurses. Option C, the consultant. And option D, all the staff. So which clearly says that the NMC rules, the nurse in charge is the overall responsibility, the one who needs to take. So the nurse in charge is the right answer. Who is the on duty? Nurse in charge. That person should be responsible for the controlled drug. Okay. Question number 6. The nurses on the day shift report that the controlled drug count is incorrect. What is the most appropriate nursing action? So the nurses or those who are doing the day shift, they are just reporting that the controlled drugs what they got it's incorrect. So what is the most appropriate nursing action? We'll see the options. Option A, report the discrepancy to the nurse manager and pharmacy immediately. You have to inform to the nurse manager. Who is nurse manager? Your nurse in charge, and the pharmacy immediately. We'll say rest all the options. Option B, report the incident to the local board of nursing. Okay, they are saying local board of nursing. We can eliminate that answer. Inform a doctor. Okay, because who is the in charge? We are the nurses are the in charges of the controlled drugs. Okay, so we cannot no need to inform to the doctor, so we can eliminate that option. Report the incident to the NMC. That is also we can eliminate because we are not going to report to NMC. So right answer is option A, that is report the discrepancy to the nurse manager and the pharmacy on duty. I'm sorry, pharmacy immediately. So moving to the question number 7, which drug is included in group A controlled drug? Morphine, codeine, cannabis, and lorazepam. Answer is morphine. Group A controlled drug is morphine. Question number 8. Your patient has been prescribed a tramadol 50 milligram tablet for pain relief. Upon receipt of the tablets from the pharmacist, you will. Okay, your patient has been prescribed a tramadol 50 milligram tablets. So what pharmacist is doing? Pharmacist is getting the medicine along with the receipt. So once they will receive, we will get the receipt. What you need to do upon the receipt of the tablet from the pharmacist? What will you do? That is a question. We see the options. Option A, ask the pharmacist to give it to the patient. We are asking pharmacist to give it to the patient. Definitely, we can eliminate that answer because why? Because always we are the responsible person to give the medicines to the patient. Option B, put it in the patient's medicine cup. That is also wrong because what we need to do, we have to call two registered nurses. We need to go to bedside, check how much we need. We need to see and we need to dispense the medicine. So we cannot put directly to the medicine cup. So we can eliminate that answer. Option C is saying that record this in the controlled drug register book with the pharmacist witnessing. Okay, so here we can see that we need to record how much drug we received from the pharmacy. That controlled register book we need to record. Then you have to see the pharmacist witnessing. Okay, in front of the pharmacist and along with another nurse, you have to record it. That is the initial initially what you need to do. Okay, that option C. Okay, we'll see option D and we will confirm the answer. Option D is saying that to store it in a ward medicine cup. It is saying that cupboard, medicine cupboard. It's say we can eliminate that answer because we have a separate cupboard for the controlled drugs. Only we need to store the controlled drugs in that cupboard. So option C is the answer. So record this in the controlled drug register book with the pharmacist witnessing. Okay, moving to question number 9. What checks are required by two nursing staff administering a controlled drug to a patient at the bedside? Choose the correct answer. Okay. What is the question? What checks are required by two nursing staff administering a controlled drug? So we are going to administer controlled drug. That day, what two nurses, what checks they need to do? That is the question. We'll see the answers. Verbal check of the patient's address. The first one is verbal check of the patient's address. Only address, patient's address, that we can eliminate because what it is, what we need patient's name, patient's hospital number, patient's address, each and everything we need to administer medicine. So not only patient's address, we can eliminate that option. Visual check of the patient's record and information on their bed. Visual check, only you need to see the patient's record and what information is there in the bed. Definitely we can eliminate that one because we are not going to do any visual check. Option C also saying that again visual checks of a patient's record while drawing up the medication. So B and C is saying visual check, that we can eliminate because we are not going to do any visual check. We have to do the verbal check. Moving to the option D, verbal check of the patient's identity compared to their identification band. Every patient's ID band we have to compare with the ID band, identification badge, and we need to do the verbal check. We need to verbally we need to tell the patient's details. We need to confirm the patient and we need to administer the medicine. So right answer is verbal check of the patient's identity compared to their identification band. That is a correct answer. Moving to the question number 10, which procedure involves two nurses? Okay, in which procedure requires two nurses? Option A, admission of the patient. Option B, counseling of the patient. Option C, serving controlled drugs. So definitely, what is the answer? Serving controlled drugs. So these are the 10 questions. Thank you so much for watching this video. See you later. Bye bye.